Hello, listeners. It's Trish Hammond here again from Transforming Bodies. And today I'll be speaking with the lovely Dr. George Calfas. Now, Dr. Calfas graduated with his Bachelor of Medicine and Surgery from the University of New South Wales, and he also got his postgraduate qualifications in physical medicine from the University of Sydney and clinical dermatology from the University of Wales. So he's very qualified to talk about a lot of things. He's the founder and principal of the landmark GMC cosmetical clinics, which are in Randwick and Narellan. And Dr. Calfas continues to evolve and deliver a diverse range of surgical and non-surgical, incisional and non-incisional face, neck and body procedures. He's a founding member and a senior fellow of the ACCS, which is the Australian College of Cosmetic Surgery, and the CPCA, which is the Cosmetic Physicians College of Australasia. And today we're talking about EmbraceRF, which is a minimally invasive procedure. So we're going to get up close and personal about that. So welcome, Dr. Calfas.
Thank you, Trish. Lovely to be here with you. Thank you.
Yeah, thank you so much for joining us today. So first of all, can you tell us a little bit about EmbraceRF technology and how this has actually benefited your practice?
Yes, of course. Trish, it's a very innovative technology, high-end technology, very sophisticated. And the important thing is that it bridges this gap that we all us have in treating patients. So the gap is, I'm talking about the patient who is too bad or too advanced to progress to get enough benefit from skin treatments, injectables, applied energy devices like surface applied lasers, radio frequencies, and ultrasounds, peels, and so on. These patients need something more because they've done all of that. It's not getting them there, but they're not ready to go to the other end of it, which is the surgical end. They're either not bad enough or they just don't want to go under the knife. And there's a great fear of surgery out there. So what do you do with these patients of ours who fall in between those two? That's the gap. Bridging the gap is really what the Embrace does. So what it does is it offers us treatment options that we can apply in that particular group of people. So bridging the gap between not good enough for medical treatments alone, not bad enough, or not going to go to surgery.
Okay, so basically for someone, well, I'm using myself as an example here, but for someone such as myself who is kind of getting a bit, wobbly around the bottom here and wanting to cover everything with the neck, that can help?
Absolutely. And that is a very typical, very common. Neck is the hardest part for patients and practitioners alike. The options have been few. So you can do, as I said, all the medical treatments and try and tighten the skin, so to a certain degree. So the options are very few. Surgery or surgery.
Yes.
And you know what we say, if all you have is a hammer, everything starts to look like a nail. So if you don't have other options, then you use your hammer. But they don't want to go there. And we'll have patients who come to us and they say, look, I'll go to the mirror doctor and I do this, I do this. This is what I want. Well, you can't get that other than surgery. But what does surgery actually offer the neck that has lost elasticity, that's had sun damage, that is aging? Surgery basically excises any redundant skin and stretches skin. No mass layer there to give you long-lasting result. It's basically the protismus, it's basically skin. So you're doing a skin lift, and skin does what skin does. You stretch skin, it's going to stretch right back. And we all get disappointed when we see patients 6, 12, 18 months down the track, and they say, oh, it's starting to come back again. That's the problem with surgery, particularly on the neck. It doesn't last. So you can get a nice result initially, but then after a period of time, that result drops away. Now, Embrace is something else. So what we're doing there is we have a different approach to the problem. The problem is the skin. It's not that it needs lifting, the skin needs to be improved. If we can improve the skin, if we can tighten the skin, if we can firm the skin, it will lift itself. And so doing this with the Embrace, you have the reverse of what you see with surgery. Surgery gives you best results up front and they fade away in a short period of time. Radiofrequency performed in this particular manner gives you good results initially, which only get better as time. So you'll find that in 6 and 12 and 18 months, the result actually continues to improve. What you've done is given a surgical-like result, but without the knife.
Okay, so you basically, you have your treatment done, and then the way you look tomorrow, in 6 months' time, you look better, and 12 months' time better, and then it gets better for 18 months.
Yes, and there are good reasons, because you're actually producing beneficial structural changes under the skin, in the fibroseptal network. These changes continue to evolve the improvement, and this is why you see in continuing improvement. So you're probably going to see about 80% of your benefit by 3 months, but it doesn't stop there. You continue to improve for the next 6, 12 months on top of that. Like
a reverse time machine.
It is. It's fascinating because, you know, to the skeptics, they say, no, they can't be happening, but it actually does.
Yeah, right. And so there's the RF, the EmbraceRF's technologies that are the Accutite, the FaceTite, and the Morpheus. How do you use those technologies to deliver the results that you want? Like, what's the difference?
Of course. Okay, well, Accutite and FaceTite are bipolar radiofrequency devices, and they have a probe that goes under the skin to deliver the energy precisely where you need it. Now, the difference between them, I'll explain what that means, but the difference between the Accutite and the FaceTite is really a matter of size, a matter of reach. Now, why is a bipolar radiofrequency so important? It is all about containing the energy where you want it. Now, normally, and we've all used energy-bearing devices such as lasers and ultrasounds and radiofrequencies, and applying that energy on the skin surface. And you're hoping to get enough energy to penetrate into the deeper layers, into the reticular network, to get sufficient heat and contraction of the network. But how do you do that? By applying most of the heat, all of the heat on the surface, and hoping enough gets down there without damaging the surface. Well, if you reverse that, then you can do exactly that. And this is the innovation with the Embrace. What you're doing is you're applying the energy under the skin through a probe. So you have a small probe, very fine. The probe of the Accutite is the same size as a 22 gauge, 6 centimeter cannula that we use to inject fillers. That's how fine it is. And you put that under the skin. You put it under the skin to deliver the energy from the tip of the probe in the subdermis where the reticular network is, and give all the energy required very precisely there. And it's being received by the other electrode at the top by going straight through the skin. So you're applying all the energy underneath, getting all the tightening over there, and you're sparing the surface because that doesn't get all of that heat. This is amazing because you can go to any level of depth, and you can go right down to the deeper fat layers. You can come under the subdermis, but you can go right to the dermal layer itself and get tightening at all different levels. And this is fabulous because it gives you nice three-dimensional contraction where you need it most. The Morpheus you mentioned is a different device. The Morpheus is a radiofrequency needling. And once again, the innovation here is that it's another way of delivering energy under the skin. And if you so wish, you can deliver it in the skin itself. So what have we got here? We've got pins, 4 millimeter long pins, and these will go through the skin through the dermis. Now, only the tip of the pin is naked, meaning that it will deliver the energy from that tip. The rest is insulated, a bit like my pencil here. This doesn't deliver any energy, only the tip does. So if you put this through your skin like this, then what's happening is you're getting all that energy delivered underneath, and you're sparing the skin. Why is that important? If you have a type 4, type 5, type 6 skin that you want to do this, don't want to deliver energy into the skin itself and risk post-inflammatory hyperpigmentation and other issues there. So you can deliver all the energy you need under the skin there without risking that. But of course, if you want to do a fractional resurfacing with the Morpheus, you can do that just as easily. And it has the ability to apply the needles at different depths. So you can go 4 millimeters all the way through. You can go 3 millimeters. You can go 2 millimeters. You can go 1 millimeter. There's also a 0.5 millimeter that you can do a really fine surface fractional resurfacing, radio frequency fractional resurfacing with. That means that you can put your deeper pin levels underneath, get tightening of your reticular network, then draw it up and get tightening of the dermis itself. So you have all layers of benefit.
Okay. And so in what situation would you use, like, say, for example, the face tight over the Accutite and vice versa, like the Accutite instead of the face tight?
Sure, certainly.
So it's one technology, but it's 3 kind of things that it does.
Yes. Well, face tight and Accutite are the same technology. Both deliver quite a lot of energy. They're quite powerful devices. They might be small, but they're powerful devices. They deliver a lot of energy, and they deliver it where you want it. Now, the Accutite is 6 centimeters long, so it's a small device. It fits in the palm of your hand. You can use this to get into tight areas where you can't get a longer probe. You can use it in small areas. So anywhere you can put an injecting cannula, you can apply your Accutite. So you can do the upper and lower eyelids, for example, and get good contraction of those. You can do lips, you can do the nasolabial folds, you can do the jowl pads, you can do the submental fat pads. And it's fine enough to get into these areas safely and do the treatment that you need to do. However, if you've got somebody who's got, say, a full neck, not just a submental fat, but they need a lot of work for the full neck. The face tight would be appropriate because it has greater reach. And so from a couple of incisions, so not incisions, but actual access points, you can reach the entire area, whereas you would be working harder to get the Accutite to treat a big area.
Got it. And so what would be the most common concern that you use Accutite for?
You got an hour or two? There's so many things.
Right.
The commonest that we see are the submental fat pads. So I'm talking about a younger person who's got this bit of fat under here and hate it because they see themselves in profile. Hate this.
All the time. I see those patients, like I get those questions all the time.
And they're young and they dread what's happening over there. Then as we get a little bit older, our faces go like that. We start to develop this and we start to lose out there. Okay, so the gel pads, we've got fat pads over here and they need to be reduced. How do you do that? Well, if the Accutite is small enough to be able to treat these areas and you can access from different directions, because all you need to access is a 21 or an 18 gauge needle and access the Accutite through that. So there are no marks left on the skin afterwards. So if you need to make more access points to make it easier for you and more precise, do so. You're not going to leave any marks behind. The other interesting thing that we've had, and this has been a bugbear for so many people, you see the malar festoons. These are the edema pockets of fluid that collect over here. And so many people have this issue. Now, what could we do prior to this? Very little. They were surgical candidates. and doing lateral canthopexies and so on to pull pads up. But now we can treat them with the Accutite. These edema pockets can be reduced very significantly with that tiny instrument put under there and treating that. So what we find, you're asking me for, how has it benefited our clinic? It's opened so many new doors, treatments that we couldn't do before effectively, and now we can. So the malar fat pads is only one of several. I think, Trish, you've probably seen many ladies complain about the bra lines and bra folds over here, and they complain, the anterior axillary folds. And it's mostly skin and other soft tissue. There's not a lot of fat there for most people. And so you try normal liposuction, that doesn't work. Try injectables, they don't work. But they do respond to radio frequency tightening, and they respond very well. Accutite works beautifully there. Again, this is another area that we used to avoid because there wasn't much chi in treatment, but now we can make some really nice differences. So it opens up so many new doors, treatments that weren't possible before, areas that weren't treatable before.
So, because last week I had a lady contacted me and she said to me, "Oh, who can I go and see? I've got vaginas under my armpits." I'm like, "What?" And I said, "Can you show me what you're talking about?" And that's what she was talking about. So it was the fat kind of between the joint of the, okay, wow.
Yes, they hate it, don't they?
I'll have to say I've got the perfect solution for you. So tell me, is there anything the patient needs to do to prepare for, pre-treatment before having anything done? Like, do we have to prepare anything or?
No. Look, these are minimally invasive treatments. And, even a young lady who's got acne, you can do the Morpheus over the acne, and it actually helps to resolve even heavy nodular cystic acne. These are minimally invasive treatments, and there's no preparation for it.
Yeah, that
no
sounds
preparation
good.
necessary. It's so easy.
Is there anything special that needs to happen post-treatment that we need to be aware of at all?
Okay, post-treatment, firstly, I think it's important to educate your patient. They need to know what they're going to look like. So afterwards, some areas are more sensitive. You're doing sensitive areas of the face, like periorbital, for example, perioral. There's going to be significant swelling there for a number of days. They need to be aware of this. The bruising, when we talk about procedures, we usually talk about bruising and swelling afterwards. Bruising is minimal with a radiofrequency device, this particular device. And the reason is this: radiofrequency does three things very well. Firstly, it contracts the fibroseptal network under the skin in a three-dimensional manner. So you get nice contraction, nice lift, nice tightening. It does this very, very well. And these are the subdermal positive changes that I was talking earlier. The other thing it does is it melts the fat. So if you're treating an area that has some fat to be removed, then it will melt that fat, and then you can aspirate that fat at the same time much more easily and much more completely than you would, say, with just straight liposuction. But the other thing that radiofrequency does is it will actually coagulate the tiny vessels that you're working through. And by coagulating them, you're not getting bleeding and bruising. So the area is amazingly free of bruising afterwards. Now, having said all of that, what do they need to do? Well, depending on the areas that you've treated and what you've had to treat, they would be better post-treatment to rest and remain well hydrated for a day or two. Elevate the area treated if that's possible. If you've done some liposuctioning, for example, the neck area, then a compression garment will be advisable. And sleeping propped upwards if we're talking about head and neck.
Okay, so what would be the downtime?
There's really not much else they need to do. Downtime is mostly the swelling. There's not bruising, but it's the swelling. So depending on the area that you've treated, the swelling may last a few days, may last several days, but it's only swelling. They don't look like chopped liver.
Yeah, and I guess that's true because everybody's different. Like I'm a big sweller, so I usually last for a few days, and then someone have the same treatment, the 2 days they're done.
Yeah, and this is so important to prepare your patient beforehand, because what you want is, I wasn't told that I'm going to look like this.
Yes.
As I said, they don't look like chopped liver. They don't look grotesque, but they are swollen.
Totally.
They have to prepare and plan.
Yeah. And I guess this is I mean, what else would you cover in a consultation? That's the sort of thing you would cover in the consultation. Is there anything else that you would cover?
In the consultation, yes, of course, as part of the consent form, you necessarily go through possible complications, side effects, as you would with any kind of procedure. It doesn't matter whether you're just injecting fillers, you need to alert your patient to possible complications from that.
Yeah. And can you tell us, you've kind of covered it, but what sort of patients is this suitable for? I know you talked about the different skin types. So, you know, for those that don't know, Fitzpatrick 1 through to 6, it goes from lighter through to darker. I guess that's the easiest way. But is there, is there any particular patient that this is suitable for or not suitable for?
As I said, anybody who's got a complaint of some loss of skin elasticity or skin laxity, lines, sun damage, it actually addresses all of these. So many people, it's not going to be a surgical procedure. And I think it's important, if somebody needs a blepharoplasty, for example, because they've got low-lying hooded eyes and this isn't going to give them a non-surgical blepharoplasty, and I think it's important. However, if that patient will not go for surgery and they say, you need to help me, I can't stand these, can you do anything else? Acutite would be ideal for that, because you can go in to the upper and lower lids, you can tighten them up as much as possible. So this is coming back again, the many patients who could probably benefit from surgery but are not ready for surgery. So they're good candidates.
Yeah, and I guess these days as well, like I've noticed that a lot of people got concerned for going into hospital because of, you know, the risk of COVID, you know, being higher. And I guess with this technology, you know, you can perform this in your own practice, can't you? So you don't have that.
Oh, yes, absolutely. There's no general anesthetic required. This is done, you could do this, say, with let's have a look at the Morpheus aids. You can do this in 2 versions. You can do a light mode, you can do a heavier mode. So what is the difference? A light mode would be, say you want to do a full face revamp. This is to tighten. It's a fractional resurfacing of the face with minimal downtime. I mean, really minimal downtime, 2 days or 3 days of redness. That's about it. So you do that Friday, you're back to work easily on Monday. Just with a topical anesthetic cream and do the treatments full face. You can do neck with that. It doesn't take long to do. If the patient has a little bit more damage and they're prepared to undergo a stronger procedure, you need to do some anesthetic blocks. You need to put some anesthesia, say in the face or the neck, so that you can ramp up the energy delivered by your Morpheus. Obviously, the more energy you deliver, more tightening, and the better the result. But there's a great many youngish people who just want a bit of a beauty flash, a bit of an improvement, a bit of tightening. They're seeing very early lines developing. They've had a bit of time in the sun past. They would do so well with just the light version of the Morpheus 8, a quick treatment, just a bit of topical anesthetic, and they get wonderful results out of this. The amount of tightening and clearing of those fine lines is quite impressive.
Yeah. And I guess that I was going to ask you, which kind of leads me to the next one. I was going to ask you what kind of results that you've experienced so far in the patients that you've done treatments on.
Yes, yes, of course. And this is, look, it's variable.
Yeah.
Because we all know that the big variable in medicine is the human factor.
Mm-hmm.
So you've got genes, genetics, so somebody may inherit good skin, somebody may not. You've got age. As we get older,
Mm-hmm.
skin loses its elasticity and responsiveness. You've got degree of sun exposure in the past. You also, another factor is how well they've looked after the skin.
Mm-hmm.
These are determinants and may influence the final results. But overall, results are really quite impressive.
Mm-hmm.
I did make a point of telling my patients, it's not a silver bullet. It's not going to take away all your problems. It's not the same as a surgical procedure,
Yeah.
but it's a very, very good non-surgical alternative.
Yeah. And so has EmbraceRF changed the way that you perceive treatment plans?
Absolutely, absolutely, yes.
Yeah.
That frustration when you have a patient sitting in front of you says, what else can you do for me? And you haven't got that what else.
Mm-hmm.
And it's very frustrating. We all experience that. Now we have that what else. The EmbraceRF is so versatile. You can do very superficial skin treatments with just surface applied energy with the former.
Mm-hmm.
You can go further in with your Morpheus. You can go under the skin and do a coagulation, or you can do a full radiofrequency assisted liposuction.
Mm-hmm.
The flexibility and the range of treatments is very impressive.
Yeah, yeah. And so they call this the precision tool for surgeons. So what is it?
Well, it is.
Yeah.
It is. It's a surgical tool without the blade.
Yeah. Yeah.
You're getting tightening. You're getting contraction. You're getting improvement of the skin surface. You're getting tightening of the underskin. These are many of these things you can't get with surgery.
Yeah.
So,
okay.
So it's. I brought the analogy of the neck earlier, of the tightening. You're going to get long-lasting results you can't give surgically. So it's unique. It's on its own, but it's a great gap instrument for those patients.
Yeah, like an in-betweeny or
in between.
Yeah,
Absolutely.
because I know for myself, I'm like, yeah, I need to go and have a neck lift. And I was like, oh, I'm a bit scared. And am I ready? So it's kind of like, I'm looking at myself now and I'm like, yeah, that would just be great if it looked like that. And, you know.
And you're absolutely right, Trish, because so many young and youngish ladies in particular who come and say, I just want a little bit of a lift. And that little bit of a lift still means a full incision, face and or neck lift. But so often we can move on to the Embrace. Look, you will get the lift that you need because you only need a moderate lift, mild to moderate lift, and we can achieve that with the Embrace. But you can't achieve that with anything else other than going full surgical procedure.
Yeah.
There's no such thing as just a little bit. So just, we've got your minimal access lifts and so on, but there's still scars.
And so why did you choose this technology?
Trish, I like to do my research.
Yeah.
And firstly, I have a look at the company itself. InMode have a very good reputation in the industry as R&D, and they mostly involved with lasers and the frequency devices. Companies that invest a lot in R&D, are going to continue to improve their products, which brings me to the other point that you're going to invest money
significant money in any kind of technology, you want to know the viability of that technology. Is it upgradable? So if the company continues to its R&D, research and development, and they come up with improvements, can you upgrade your existing machine to accept these improvements? Mm-hmm. So that is very much a factor. The other thing also is a company that is going to back its product, mm-hmm. Sales, service and support. Also a company that's going to promote mm-hmm. its products and the practitioners who invest in their products. And InMode certainly does all of that. Mm-hmm. You want to find out if there is a gap in the market for your product. Is it, it may all look and sound very good, but is there a demand for that procedure? And certainly we can tick that box with InMode, with the Embrace.
Yeah, it's funny because I see new technologies come along quite often, and then sometimes something's a bit of a standout and you think, oh wow, there's something here. And I think that's how I feel about the EmbraceRF. So yeah, I think you're onto something there.
Absolutely, I couldn't agree more.
Yeah, awesome. Well, look, I've got to say you've answered every single question I could possibly have about the EmbraceRF. I've got to say thank you so much for your time today.
Thank you, Trish. It's been a pleasure.
Lovely. And listeners, look, if you want to go and check out Dr. Calfas and what he does, or if you're after a treatment done with the EmbraceRF, you can see him at the GMC Cosmetical Clinics. Like I said, they're at Randwick and at Narellan. And if you're a practitioner who's looking for something different in your clinic, this could be just the right thing for you. So you can contact InMode direct. So I want to say thank you so much again for joining us, Dr. Calfas.
Thank you so much, Trish.
Have a great day.
Thank you. And you too.
Bye.
Bye-bye.